Hi, I'm Dr. Greene. I'm going to be demonstrating a Botox injection today. As you may well know, Botox is a very popular cosmetic treatment today, and it's typically used for treating the upper face and sometimes the lower face as well. Botox is a treatment that is used typically to relax areas of the face. It's a common misconception that it's used for paralysis of the face and that it creates a frozen look. In my opinion, this is typically as a result of over-treatment or mistreatment of the product. In the proper hands, I think Botox is an excellent treatment which is used to relax areas, looks very natural, and I think that's why it's very popular with many patients today. Now the way Botox works, again, it relaxes the muscles. It is treating lines of the face, and the lines of the face are really caused by muscular movements. We call these dynamic wrinkles. And so when you deposit the Botox into the muscle, what happens is it relaxes that muscle and thus smooths out the skin over it and smooths out the lines and helps prevent those lines from forming. So now I'm going to demonstrate a few of these areas. A lot of patients who come in ask for one area to be treated, but a lot also ask for sort of an entire treatment of the upper face. So I'm going to demonstrate some of this now. So in this patient, go ahead and frown for me. Okay, so you can see in this area here where she's frowning, these are called the glabellar lines, and some people call them the 11 lines. And this area here, you can see the line that forms on both sides of the glabella. And then there's a muscle down here called the procerus. You can relax now. This area here, this horizontal line, is formed by the procerus muscle, which is at the root of the nose here. And then there's some other muscles here, most notably the corrugator muscle that travels in this direction. And this is another muscle we'll be targeting in addition to the depressor muscle here. Okay, so that's for the glabellar area here, which is a very common area. Okay, go ahead and squint for me. Okay, great. So when you squint, you can see these crow's feet that are forming here. These are dynamic wrinkles on the outside. This is formed by the orbicularis muscle. The orbicularis muscle is a muscle that goes around the eye, but it creates wrinkles on the outside of the eye. Okay, so we'll be treating those as well. Raise your forehead for me. And then the forehead, this is the frontalis muscle, a very large sheet of muscle here on the forehead, serves to elevate the brows and form these forehead wrinkles. Now this isn't, okay, you don't need to raise anymore. This area here, this is a common area of over-treatment in my opinion. I think if you over-treat here, you can get a nice smooth forehead, but this can lead to a little bit of less expression. So for that reason, I think it's good to be a little more conservative in this area, but still treat the lines where you can really eliminate those forehead lines and create a nice natural look. In addition, since they are the frontalis muscle is a brow elevator, if you over-treat, the brows can tend to drop, and if you do this, patients may complain that there's a little bit excess skin and lateral hooding over the eye. So this is definitely something that we want to avoid. And finally, a lot of patients really like when I do something called, some people call the chemical brow lift, and that's where into the brow depressors we relax those muscles there. And in doing so, we get a little nice subtle elevation of the brow, and I think it's really nice and natural. Again, we don't want to create an overly elevated look, but you really don't. Whenever we treat that area, we really don't get that effect. So it's a really nice softened look with a slightly elevated brow. So today, those are going to be the areas that we're going to be treating. Again, there's some other areas of the lower face that can sometimes be treated. This is not quite as common, I think, in most patients, again, the upper face. And for most patients, doing it, say, maybe 3 times a year tends to work well. Botox usually lasts between 3 and 4 months. It just depends on the patient, their metabolism, and other factors. But important thing to note as well is that when we treat, that we really are targeting these muscles and make sure that we're not really going outside the confines so that we don't go into other unwanted areas, other muscles we're not trying to treat. So now I'm going to show you the tools that we use for the Botox. Okay. Now Botox comes in either 100 unit or 50 unit vials. I usually use the 100 unit vials when you're injecting higher volume practice. You can see here that the vial comes in a lyophilized formulation where it's basically a powder that you reconstitute You can do that with sterile water or with a bacteriostatic saline, and I like doing the bacteriostatic saline. Personally, that's my preference. I think for there's a lot of different dilutions one can use. 2.5 cc is one, 3.3 cc is another, and then you can even dilute even more. My preference is for 2.5 cc, and the reason for that is because as you increase your dilution, you also increase diffusion of the product after it's injected. And again, going back to the possible unwanted areas, other muscles being treated, that diffusion, sometimes if you over dilute, the Botox could diffuse into other areas that we don't want and could cause some adverse side effects like an eyelid ptosis or other things like a lip drop. But again, in experienced hands, these things really should never happen, just because if we're targeting the muscles and using correct dilution, the correct product, those things, those adverse events really can be minimized or not happen at all. One thing that's important to note is patient comfort during injections. I take this very seriously, and I like, some people I know use a little bit larger needles. I prefer a 31 gauge needle. 31 gauge needles are found on insulin syringes, and insulin syringes, the one that I use is a 0.3 cc syringe. But this 31 gauge needle is very small, and I've had patients come in who've been injected elsewhere, and they tell me that these injections feel better than where they've been injected at other places. And I think there's always going to be a pinch. It's not going to be a treatment where you don't feel anything, but it should be as comfortable as possible, and I think this really maximizes patient comfort. Secondly, the use of a cold pack I think also will help. Some patients don't ask for this or don't want it, and that's okay, but I think for most patients a little bit of cold onto the area before the injection I think will help as well, just to make it as comfortable as possible. And the final things that will sometimes you want to have with you would be some 4x4 gauze and some alcohol for prepping the skin, which we've already done. I've already prepped the skin today.